Everybody knows that cigarettes are bad for you, but do you really know the true reasons involved on why? It's known that cigarettes gives you acne, yellow teeth, and it makes you stinky. But even though all of these are enough reasons to not ever want to smoke, there's more serious health risks involved. According to the CDC, the adverse effects of smoking cigarettes contribute to the top 3 leading causes of death in the United States. The adverse effects of cigarette smoking account for an estimated 443,000 deaths, or nearly 1 in every 5 deaths. Cigarettes contribute to more death than HIV, illegal drug use, alcohol use, motor vehicle injuries, suicides, and murders combined. We will look further into how cigarettes have an effect in producing the top 3 leading causes of death, which are heart disease, cancer, and pulmonary disease. To begin with, heart disease. This is the #1 cause of death in the United States. Cigarettes contribute to this in several ways. One of the ways is by causing atherosclerosis. Atherosclerosis is a buildup of fatty substances in the arteries. How atherosclerosis works is the normal lining deteriorates, and then the fatty substance builds up, and it prevents blood flow. If you get atherosclerosis in the coronary arteries, those are the veins that actually supply oxygen to the heart, you can increase the risk of getting a heart attack. Due to having narrowed arteries, the demand for oxygen forces your heart to work harder. After doing this for so long, you get permanent high blood pressure. After some time of straining your heart, you can also develop muscle damage to your heart. The second leading cause of death in the United States is cancer. There are several areas that your body can get cancer due to cigarette smoke. These include the lung, the larynx, oral cavity, the pharynx, esophagus, stomach, pancreas, the cervix, the kidneys, the bladder, and acute myeloid leukemia. The most common area to develop cancer is obviously the lungs. Smoking contributes to 80 to 90% of cancer deaths in men and women. Lung cancer is the most fatal of cancers due to it not being detected until advanced stages. Also, the rapid rate at which it grows makes it fatal. The third leading cause of death is pulmonary disease. The main pulmonary disease associated with cigarettes is COPD. It stands for chronic obstructive pulmonary disease. Smoking cigarettes is responsible for 80 to 90% of COPD cases reported. Smokers are 10 times more likely to die of COPD versus a non-smoker. There is currently no cure for COPD, and whenever it is diagnosed, it is usually already in an advanced stage where there's irreversible damage. Some of the symptoms that occur with COPD is chronic coughing, frequent colds, lung infections, and difficulty breathing. COPD will include emphysema and chronic bronchitis. Chronic bronchitis is the inflammation of the lining of the airways, or the bronchial tubes. When your airways are inflamed or infected, less air is able to go in and out of the lungs, and you cough up heavy mucus or phlegm. Some of the symptoms of chronic bronchitis include excess mucus, the lining of the airway becomes thickened, irritating cough, decreased airflow, and lung scarring. The other issue is emphysema. Emphysema causes a loss of elasticity in the walls of the air sacs of the lungs. Eventually, the walls will stretch so much that they will break and they will create large air sacs versus the small little air sacs that we normally have. This will create less efficient lungs that can't handle the normal exchange of oxygen and carbon dioxide. Some of the symptoms of emphysema include mild chronic cough, weight loss or appetite, and fatigue. So in conclusion, there are many health risks associated with smoking. The most fatal ones are heart disease, cancer, and pulmonary disease. These risks involved are usually dedicated to detected only once the damage is permanent and irreversible. There are many methods to assist quit smoking, like medication, mediation, and self-discipline. Smoking should be stopped as soon as possible to prevent any of these diseases from developing or further